The supplement market is approximately between 210 billion USD, according to a 2025 research, and is suggested to exceed 430 billion US dollars within the next decade. So detoxes and cleanses are everywhere. Everyone's talking about it. There is a booming industry, and this industry is projected to grow. So does supplement fix health problem? What is the truth?
Supplements. I'm glad you brought it up. The supplement industry is profit driven.
Yeah.
So the reason they are there is to make money, really, not necessarily a healthier person. That's one. Then two, okay, I was also thinking, now a lot of times once a woman turns 40, there's all this marketing,
Yeah.
you need this supplement,
Thank
you need
you.
that supplement, you need
Yeah.
this supplement. And then I would usually say that if I'm eating well, why do I need this supplement?
Okay.
Now, for example, they tell you now, okay, if you look at vitamin C, right? Vitamin C tablets. So the tablets may actually give vitamin C.
Okay.
But then if you take an orange,
Yeah.
it will give you that same vitamin C.
Okay.
But it will give you more. It will give you fiber.
Okay.
Do you understand? So it's not the supplement you need, it's the food source you need.
Okay.
Now, the reason you need the food source more is that you know what you're taking. But the supplements, you don't know what's inside. It's what they
Sure.
tell you is inside that you think it's
Yeah.
inside, right? But you don't actually know what's inside. Now, a person who is eating healthy does not necessarily need supplement.
Okay.
Are there cases where we prescribe supplements? Yes. When we find there's a deficiency.
Okay.
For example, somebody we've run a test for and it shows the person has calcium deficiency.
Yeah.
We can prescribe calcium tablets for that person.
Mm.
But we're not going to say, go and be taking. We're going to say, take it for 2 weeks or take it for 4 weeks.
Yeah.
Do you understand? So even when we prescribe supplements, it's for a short duration. Another set of people who may need supplements are pregnant women, because during pregnancy, the need is more. So if you don't give her supplements, her iron may come crashing down. She might not have enough calcium to sustain her baby.
Okay.
So she needs to be supplemented. Those people need supplement. But there are people who, for example, people who stay in areas where there's not enough sun.
Okay.
They may need vitamin D supplementation.
Okay.
But those of us who are, we stay with sun, and sun is our person. We don't necessarily need vitamin D supplements. But this supplement industry now keeps packaging, okay, you need supplement to sleep well. Why are you not sleeping well? Is that not something you should be thinking about? Why am I not able to sleep well? Let me address the reason I'm not sleeping well, rather than taking supplements to make me sleep well. So are you going to be taking supplements for the rest of your life?
Okay.
Now, and then we don't know how far this supplement. So say a supplement is giving you calcium. What else is it putting in your body? You don't know that. The company will not tell you that, because if they tell you that if you take these supplements, it might affect your kidney, you will not buy it. So they will not put it there. And then because it's not closely regulated, nobody is monitoring them to ensure that they put everything, because any drug should put the side effects in that drug. But supplement industry will not tell you that.
Yeah.
Now, a lot of people now take several supplements. A patient came to the clinic one time. By the time she mentioned her complaints, I said, please, which supplements are you taking? She mentioned this one, mentioned that one, mentioned that. So she was taking several, I think she was taking like 4 different supplements. Why are you taking all these things? And that her friend takes it, that her friend just turned 40, and her friend said, some other people will tell you that, because it will give me popping skin.
Okay.
How about you do something else to make your skin pop? You eat very well, you sleep very well, you are careful with your hygiene. These are things that would help your skin to pop. But what I found is that we like shortcuts. So instead of us going through the trouble of taking an orange, digesting it, and getting the maximum benefits, we want quick fix. So we now take it. Now, that's on the supplement part. And then you also mentioned detox. The detox market is also a booming one.
Yes.
because
It's booming,
yes, it's booming because I mentioned too that we like quick fixes, right? So when we hear that, if you take this one, it will clean your body sharp, we want it.
Yeah.
But there are other things that could clean our body. Clean up your diet.
Okay.
If you're eating clean, why do you need to clean up your body? That's one. Then two is that the liver and the kidney, their function is to detox you. So whether you're taking detox tea or not, the liver and the kidney are already detoxing you. If, for example, you now feel like, okay, I need to detox, the liver, they are doing it all. But you now need to watch that you're eating healthy. you're not packing a lot of junk. And people who want to detox are people who say, I don't too chop nonsense.
Yes.
I want to clean my body.
Yes.
But the truth is, if you now eat better, the body will handle those nonsense you have taken,
Okay.
hoping that you don't make it a consistent habit.
habits.
Because the truth is, if you make it consistent, eventually your liver and your kidneys get overwhelmed.
True.
And then they now leave it for you. And then that's when the person that starts to contend with some of these illnesses. So just allow the body to do what it is meant to do. Because by the time you're taking all this detox tea, you don't know what those ones are also doing.
Okay. All right. When people come down with blood pressure, the normal question is usually, what are you thinking? Suggesting that high blood pressure is caused by thinking too much. What is the size or the truth about blood pressure?
Okay. Blood pressure is not necessarily caused by thinking. Now, what happens is that a person who is stressed, right, is likely to have blood pressure spikes. But if that stress is handled, the blood pressure will stabilize.
Okay.
Right? But if the person is now consistently exposed to stressor,
Okay.
and that stressor is not properly managed, the person may come down with hypertension because the trigger hasn't been removed. Now, aside that, there are majorly hypertension occurs when a person is prone to developing hypertension. There are just some people that, by virtue of being born into certain families, being of African descent, they are prone to being hypertensive, meaning that it's hereditary, it's in the genes, right? But there's something interesting about heredity. It's like a gun, right? They say it's usually said that heredity loads the gun, but the environment, your lifestyle choices, pulls the trigger. Because a loaded gun really doesn't kill, but it's only when the trigger is pulled that it does the harm. So a person who is prone to hypertension, who modifies his lifestyle, may not come down with it. So overthinking, does it cause hypertension? Not directly, but it can increase the blood pressure. And then the increase in blood pressure that stress actually causes is a slight increase. It's not like somebody would say, a patient I saw said the reason his blood pressure is high is because he's thinking. And this blood pressure we're talking of was 200, 120. And then I said, imagine if thinking causes blood pressure. That means a lot of Nigerians will be having 200, 120.
Yes.
But then it's not because he was overthinking. It's because something else triggered it. So stress will not cause that kind of BP. It will just cause transient increase in BP and then it stabilizes. So there's, like I mentioned, there are some people who are prone to it. Then their environment will now worsen it.
Okay. Conventional drugs are failing and people are gradually choosing traditional or herbal options. So you hear things like herbal and traditional medicines have no side effects. Is it true?
It's not completely true.
Okay.
There's no drug that doesn't have the potential to cause side effects. Everything that is a drug has the potential to cause side effects. But then I understand where this reasoning comes from, because a lot of herbal mixtures are natural substances, right? So, and then, the best is usually natural, right? But then some of these herbal mixtures, one, they are mixed with alcohol. So we've had patients who tell you that they're taking herbal medication. If you trace it, they are taking a lot of alcohol because it is mixed, and it's not just beer, it's whiskey, gin.
It's soaked in whiskey.
So they're taking a high concentration of alcohol. That's one. Then two is that if you're taking a drug, you should at least know how it works. Right? So now a lot of these herbal mixtures, we only know that this one will cause would take care of constipation, right? We don't know what else that drug can do. Especially because a lot of people who take herbal medications take them for a long time. So say, for example, the person is now taking it consistently. We don't know yet what that damage, the damage that herbal medication is doing. But now the conventional orthodox medicines, for example, paracetamol, they'll tell you that, these are the possible side effects. So when you now say, all English drugs have side effects. But it's not everybody that takes paracetamol that comes down with that side effect. It just means that some people are likely to have side effects. So it's not that every time you take an English medication, it gives side effects. So it's not that English medications are unsafe, herbal medications are safer. So it's a question of be careful what you do so that you will not go and spoil something.
Okay, we seem to have a lot of antibodies abuse because many believe antibiotics cure all types of fever. Does it?
No, it does not.
Okay.
Typical example in our environment is malaria. Malaria is not the organism causing malaria. It's not a bacteria.
Yeah.
So the antibiotic you are taking is not treating that malaria. Another example is what we call catarrh.
Yeah.
Or cough. The commonest cause of catarrh and cough is viral. It's a virus, right?
Okay.
So taking antibiotics does not get rid of the virus.
Okay.
Now, interestingly, because catarrh has a time frame, right? So catarrh, 3 days, 5 days, cough, 3 days, 5 days. Most viral illnesses have a time frame. So within 3 to 7 days, the illness has run its course by itself. It disappears. So, but the person who now started taking antibiotic, the common one is amoxicillin, will now think that is that amoxicillin that treated that catarrh, not knowing that the virus simply ran its course and then the body got rid of that problem. You know, so that's the common thing. The same thing with malaria. Now, a lot of times people now tell you that they take to treat malaria, they take anti-malaria and then they take an antibiotic. The anti-malaria has gone to do its work, but you're now thinking that it's the antibiotic you took
that did the work.
Unfortunately, the more we abuse antibiotics, the more our body builds resistance to it. So that by the time the person now eventually needs antibiotics, the body is resistant to this one, that one. Will not be using highfalutin antibiotics that tend to have their own side effects. So that's just it.
Okay. Another one is pregnancy means eating for two. Is that true?
It's not true, please. It's not true. You eat for two, you be fat for two. When you now finish doing, you now want to lose weight. So it's not true.
Okay.
Of course, pregnancy means that there's increased metabolic demand, right? But it doesn't necessarily mean that the person now has to eat for two. It just means that the person has to eat healthy, so that the body has adequate nutrients to take care of the increased demand on it. Do you understand? So it's not that you now have to now bring more food,
double your portions.
Yes, because the truth is, you now eat more food, the body will save it as fat. That's why we now have it that a good number of pregnant women, they put on a lot of weight with pregnancy and then breastfeeding, because the eating for two doesn't stop after pregnancy. They tell you that you're breastfeeding, you should eat more, because you're eating for two. So the person now puts on a lot. So by
the child is taken from here.
By the time the person is resuming from maternity leave, so it's not necessarily it's not necessary that you eat for two. You just eat healthy to meet the increased metabolic demand.
Okay, I think you also talked about this, but let me also reiterate it. You need to flush your system regularly with bitters or antibiotics. Is that true?
Please don't do it. Please don't do it. Okay, like for example, these bitters is alcohol.
Yeah.
The common bitters is alcohol.
Exactly.
So imagine trying to flush your system with a problem. So please don't do it. The same thing with antibiotics. I would usually have mothers who their children are resuming school tell you that please, he's resuming school, just give antibiotic so that you know it's not what should be done. It's not what should be done. It's not every time the body needs antibiotics, because the fact is, too much antibiotic use gets rid of the normal flora. Now, in our body, there's what we call normal flora, which is the normal the normal bacteria that should be on the skin, that should be in the stomach, that should be in the female reproductive tract. So by the time you take antibiotics, the antibiotic will not go only to the ear and treat whatever you want to treat. It's around the whole system. So you're now getting rid of the normal bacteria. Now, what those normal bacteria do is that they prevent the bad bacteria from having stay on the body. They get rid of the bad organisms. So by the time you've gotten rid of them, I had a patient that said that she'd been having consistent discharge. Every time she's having discharge, I now found out that she's been taking antibiotics back to back. She has now taken so much antibiotics. She has gotten rid of the normal organisms that should be in the female reproductive tract. So now she's not having repeated infection because of that. So that's what the bacteria they should do. By the time you're taking the antibiotics repeatedly, you get rid of them, and you're now faced with a bigger problem apart from the resistance issues.
Okay, all surgery is dangerous and should be avoided. Is that true?
all surgery is risky.
Okay.
All. Should it be avoided? Maybe not. Now, for example, a patient has appendicitis. You now say because surgery is risky, I will not do. He will not go home. The appendix will not burst.
The person will die.
Person will not die. So you are trying to avoid one problem. You ended up with a bigger problem.
Yeah.
So it's true that all surgeries are risky. There is no one that doesn't have a potential risk. Everyone. That's why you see that somebody just went for ordinary hernia, the way they say it. So the person goes in for hernia surgery and the person may not survive. But another person will go for a brain surgery and come out kicking. You know, so every surgery is potentially dangerous, potentially risky. But can it be avoided? Not every time. If a woman is pregnant and she's not able to deliver vaginally, she needs this cesarean section to bring out the baby. She now says, no, it's risky, it's harmful, I'm not going to. And then she loses the baby or loses her life. You know, so I remember a co-worker we used to have when I was a younger doctor. She did not want to deliver via CS, but she said no, that they don't used to do it in her family. They don't used to do it. Meanwhile, she had passed her date. She was not able to push out the baby. She now said she must push this baby. She now went to one traditional birth attendant. That one was not pushing, forcing the baby. Forcing. By the time she was rushed back to the hospital, baby had died inside the womb. Now, imagine going through 9 months of pregnancy and then at the end, because she did not want to do surgery. So surgery may be necessary, but then it has its risk.
Does eggs contribute to high cholesterol?
Eggs do not cause high cholesterol. Eggs are healthy, especially when it is boiled, right? By the time eggs are fried, the whole frying process introduces some chemicals into the egg, right? But boiled egg would not by itself cause high cholesterol. Okay, so what would happen is egg contains what we call good cholesterol. There's dangerous cholesterol and there's the one we call, that's the LDL and the triglycerides. Those are the ones that have the potential to harm the body. But egg has good fat. Right, so the fat in egg is healthy fat, not dangerous fat. So it's the dangerous fat that goes on into the body and now stays as lipid and then predisposes the person to having plaques, that's collection in the blood vessels, right? But the healthy fats in egg wouldn't do that. So egg does not cause high cholesterol.
Okay. Breakfast is the most important meal of the day. How true?
You know, this I got to find out that this breakfast is the most important meal of the day was initially said as a marketing gimmick for a cereal company, right? So they needed to sell their market, and then they made us believe that breakfast is.
And I think recently that same company, which you can't mention their name right now, is also promoting another one right now in Nigeria.
Okay,
talking about breakfast too.
So you can see that it's a marketing gimmick. That's one. Then can we do without breakfast? Some people are able to. Right now, if your body system is stable, that your lifestyle has been consistently okay, it means that your body is not dependent on a supply of glucose at a particular time of the day, right? Because the body normally, when the glucose in the body is low, the body goes into the reserve to bring out glucose, to bring out energy, right? So that means that you can function well without breakfast. However, breakfast, dependence on breakfast is also programming. Like what this marketing company is trying to do. It's trying to program us to depend on breakfast. So by the time we are used to eating breakfast, anytime we don't eat breakfast, it seems like we cannot function. Right? So it's a function of what your lifestyle has been, really. Then of course too, it's not like breakfast is bad. Now when we eat, it gives our body nutrients. Should give our body nutrients if we eat right. But then when we eat, it gives our body glucose, it gives our body energy to function. Okay, because if people are hungry, they cannot function maximally. So of course, if you've trained your body to need breakfast, please eat breakfast. But then it should be food,
Yeah.
not the one the marketing the breakfast company
wants
is
you to
marketing.
Okay. You need around 10,000 steps every day to stay healthy. Every day. Is that true?
The more steps, the better.
The more steps, the better.
The better. But any step at all is better than nothing. So it's not like you must do 10,000 steps. It's that you must move. So you shouldn't be a couch potato. You're always sitting down. You're always lying down. That's the one that is unhealthy.
Okay.
But you mustn't necessarily get to 10,000 steps. If you're able to get 10,000 steps or more, it is better for you, really. But it doesn't mean that if you don't do 10,000 steps, you will not. It's not good at all. It's better to do something. Better to do 3,000 than to not do anything. But like I said, the more, the better. So as long as you are able to do 10,000 steps, you get the benefits accrued to those who do 10,000 steps. Because when you exercise, your body feels better. Your body does better. And then the more exercise you're able to do, the better for your body.